So one thing that patients absolutely hate, and I noticed this when I was working as a doctor, is they absolutely hate having to repeat themselves to every single clinician that they see. Repeat the story from the very beginning all over again. Why is it that this happens? One explanation is based on how doctors are trained to assess patients. So at the beginning, you need to take a history from the patient. That includes the history of presenting complaint, aka repeating everything that's been discussed already, the past medical history, aka repeating everything once again, family history, medication history, allergies, you get the point. And then you can move into examination and further tests and finally agree a treatment plan. The reason why this happens is because this structure gives a format to make sure that doctors don't miss anything important. And it also helps to feed into essentially the decision-making process on how doctors make their actual clinical decisions. This structure is basically how a doctor thinks when they're speaking with you. From experience, you can't ever truly guarantee that the doctor who's seen the patient before you has actually made the right assessment. And this is especially important in the context of A&E departments that are working at capacity, and you have very, very busy clinicians who are making quick decisions and getting patients up to the wards. This ties directly into my next point. When you're making decisions about patients, you're essentially under an extreme level of legal scrutiny. You need to be making the right decision. So having that authentic, full assessment from you is really important to protect yourself medico-legally. Hence, all the questions again and again and again and again. Now, I'm not saying this is the best system, as I know it's very frustrating and takes up a lot of time and contributes to a lot of waste, but the question is, what could we possibly do to make this better? There's an argument for additional clinical support tools, perhaps AI can have some involvement, but the question is, how long is it going to take for this kind of tool to make a real difference at the clinic level? Now, I hope this has shed some light, and I'm very curious to hear your thoughts. Do you mind having to repeat yourself every time you see a new doctor?